Does Medicare cover telemedicine, and what the heck is that? Well, we're going to take a look at that today. This is Bob Vineyard, your Medicare expert with a Georgia Medicare Minute. Okay, telemedicine. This is something that actually has been around for a while. Various insurance carriers have experimented with it. Some of them have doctor hotlines, others have nurse hotlines. And basically, if you have an after hours situation where you don't want to get dressed and go to the emergency room or a walk-in clinic or something like that, you can call and actually talk to a real medical person who will offer some kind of advice, maybe even a diagnosis and prescribe medication. Okay, that is something that's been done on a limited basis, and there are a lot of questions about it, but we're not going to get into that today. What I'm going to tell you, as of March 6th of 2020, which is about 3 weeks ago, Medicare announced that they would pay for telemedicine. And basically, telemedicine is kind of like a house call, or a doctor visit, where you go to the doctor. It's kind of like that, except it's done by telephone or possibly a webcam, such as what I'm using for this video. And essentially, you have the ability to communicate with your doctor or nurse practitioner or whoever and tell them what's going on and what do you think? Do I need to be seen, or can you take care of it now? And all this is really, I think it's a pretty good thing. It does have some limitations. There's some caveats that go along with it. But I think it's a good thing. Basically, Medicare has said that if you have an established relationship with a doctor and you need some kind of a consult, obviously it's not, look at this x-ray and what do you think what do you think this is, doc? It's not like that, but it's basically if you need a consult and you either don't want to get out or you can't get out for various reasons, and so basically you and your doctor or other practitioner can converse, like I said, by phone or video cam, and you can take care of that. They can bill Medicare. Medicare will pay for it. There are some other parameters I'm not going to get into, but your doctor, your healthcare provider will know what those are. So actually, I think this is a good thing. The memo that was released by Medicare says this is in reaction to the COVID-19, Wuhan flu, whatever you want to call it, healthcare crisis, which indicates that it's got a termination point. And but I have a feeling that this will probably continue on, in some form or fashion, continue on after this crisis is over. Now, that being said, I will tell you there are some caveats associated with this. Anytime there is some form of crisis, there's always somebody out there hoping to capitalize on it. And when I was doing research for this, I ran across a couple of news reports that were promoting a Medicare health hotline. That's not the name of the company, but if you really want to know, you can put your Google fingers together and you can probably figure it out. But basically, this is supposedly a medical group that is taking patients on nationwide. Operators are standing by. They're operating 7 a.m. to 7 p.m. I don't know what time zone. Maybe all the time zones. Who knows? 7 a.m. to 7 p.m. 7 days a week, and they'll take your call, and they'll do all this, and they will bill Medicare, and that's the way it is. I personally would be wary of entering into a relationship, a healthcare relationship with somebody that you don't know. They're just on the other end of the phone. That's not your regular doctor. I personally have some concerns about that. There's a whole number of areas there where you can be your personal and financial information can be compromised. Let's just leave it at that. And I'm not saying these folks that are popping up, and I'm sure there's more, not just the one I found. I'm not saying these people are all scammers. I'm just saying be careful out there. So that's what we have to report at this point on the Medicare telemedicine benefit. This is Bob Vineyard, your Medicare expert with the Georgia Medicare Minute. You take care. Have a great day.